सेहत है तो सब कुछ है.
Today we will be in discussion with world-renowned expert Dr. Ranjan Kumar Mohapatra, oncologist, Apollo Hospital, Chennai. Hello doctor, welcome to the show. Doctor, are there different types of lung cancer?
Yes. Now, if you look into the advancement in management of lung cancer, this is becoming more and more towards the type of lung cancer we are dealing with, particularly the histological type. Broadly, it is like a non-small cell or it is a small cell variety, depending on the size and morphological picture they categorize. Nowadays, approach is not same for small cell, it is different as compared to non-small cell lung cancer. Non-small cell lung cancer in early stage, it is amenable to surgery, where it is a curative treatment, most of the patients plus minus radiation and chemotherapy. But in small cell lung cancer, the approach is mostly chemotherapy plus minus radiotherapy, which may be in limited stage or early stage, it has got a curative potential. But as the major bulk of the lung cancer, we deal with non-small cell lung cancer. So, if you look into the subtype, that is going to be the key factor nowadays, which drugs to be used, which drug is more effective for particular subtype of lung cancer, which type of lung cancer particularly is more susceptible to be blocked or controlled by a particular drug. There are different targeted drugs used, different chemotherapy drugs used. Now, there are tools to find out which chemotherapy will be more effective in particular lung cancer that can be used for this type of lung cancer patients. So, now major concern is to get a better tissue to have a better subtyping done, and your pathologist should be tuned to the requirement of our oncologist. So, it is a teamwork. So, probably that makes a lot of difference nowadays in the management of lung cancer.
What is the role of a caregiver when a loved one is undergoing treatment for cancer?
Yeah, if you look into this particular aspect, it is not most of the time addressed by oncologist, because definitely they are in the other side of the table. And if you look into patient's family, they have a diagnosis done of advanced stage lung cancer, which is not going to be cured, and they live with a hope that they may live longer and they should not have a painful death. I think everybody has to be counseled there, so that they look after the patient as well as the whole family, and that is the reason you need a team of people to deal with this disease, and particularly a social worker, psychologist, even psychiatrist. They are involved in managing patients. We know some point in advanced stage we lose the patients. So, that has to be kept in mind, that we have to deal with a dreadful disease. At some point we may lose the patient. So, I think the relatives or the attenders, they should look into, they should understand that we are treating a patient which should live longer, and their psychology has to be dealt with. We should not go by our only whims and fancies and own way of thinking. So, you should look into the patient's angle, how they can ask stupid questions sometimes, but you have to be patient to answer that too.
Doctor, are there day-to-day lifestyle modifications that men can make to reduce the chances of developing cancer?
Of course, I think this is becoming a lifestyle disease. When you are living longer with a disease like lung cancer, I think we need to find out the factors involved in causing cancer. So, cancer being a disease which we do not have a definite cause, we know there are multiple factors involved. As you know, lung cancer is a major health problem with smokers, and those who are exposed to the chemicals like asbestos or industries where you have chemicals. So, if you know these are the major risk factors for developing a disease like lung cancer, I think we need to educate people, and we should make sure that we also understand from childhood itself the exposure should be restricted. I think proper education even for childhood itself, they should know that smoking is injurious to health, and even the children should be aware that they should stay from even second-hand smoke exposures, particularly those who are staying in an environment and there are smokers parents, and then you get indirect exposure to the carcinogens.
Like, share, subscribe for more such informative videos.